So how's it going, guys? So this is Dr. Suh at Specific Chiropractic, providing Gonstead Chiropractic NYC. So we have a guest over here, got like several things going on. Okay, so let's break it all down. What can I do to help you, miss?
Yeah, I have this pain in my
Actually, we gotta speak a little louder.
pain on my back of the neck and my essential tremor,
Okay.
my back pain,
Mhm.
and my lower back.
Okay. During our consultation, you also mentioned that you used to have, you were diagnosed with Meniere's disease as well, correct?
Meniere's disease, yeah, in my right ear.
In the right ear.
Yes.
Okay, and how long have you been having that problem?
Since 2005.
Okay, so 05. Got it, 2005. All right, okay. All right, and how long have you been having the essential tremors?
Many years already, but it's getting worse for maybe 5 years now.
Past 5 years. So raise your hands up a bit. Okay, so, okay, go ahead, lower your hands.
Left.
Yeah. Okay. So we got some such. So it's not too bad when it's not all the way down, but the moment you start rising it up, that's when you start to have the such a tremors, and worse on the left versus the right. Okay. All right. Let's take a look. See what's going on. All right. So based on the history, we got the right ear Meniere's disease, and we got the essential tremors where it's worse on the left, especially when we start rising the hands. And on top of that, just quickly, I'm looking at the x-rays. She has a grade 2 spondylolisthesis on the low back. So that's going to add an interesting curveball in terms of complications, in terms of how to manage this issues over here. So very briefly, essential tremors usually is involved with this region over here. So the fact that she's trying to raise her hands, it changes the shoulder complex and the biomechanics of this area over here, results in this to be torqued even more and exacerbating the issue. So I'm going to take a closer look, see what's going on over here. The fact that already I'm seeing it's so swollen over here. So I wouldn't be surprised we start to see some abnormal heat temperature here, and also something down here as well. There's also, I'm seeing here, there's quite a bit of swelling down here, mostly on the right hand side, and also at the base of our neck over there as well. All right, so that's what this instrumentation is all about here. Okay, so basically when the tissue gets damaged over there, it initiates that inflammatory process, increasing vascular supply, and the byproduct of that's going to be more heat, and that's what this device here picks up. So in addition to her muscle is going to start spasming, splinting, and there's going to be more increased edema and fluid to stabilize the joint. So we found some potential areas here. Okay, we got 2 regions of the neck actually. So with that grade 2 spondylolisthesis, it should not be any big surprise where there's a lot of swelling and edema. All right. Now we're going to check for any fixations. Yeah, that's moving just fine. It just starts locking up right here, not moving. The right hip is just fine. See right here? That's where it locks up. It just doesn't move. This is moving just fine. This is not. So that's where her problem is. So we got that problem there. See, so when I trace it down, there's that pitting edema. That means it just gets stuck right here. And it correlates with that reading what we got is level 2. And we test it. And it's also stuck and fixated as well. And biomechanically, what I was also seeing on the x-ray, that's one of the key components is that her spine twists and arcs, and here's one component here. And then it starts doing another arc over here. And it's going to be that second dorsal over here. Yeah, this is just a very, very wicked side slip right there. Okay, go ahead, relax. And we got a lot of swelling over here too, right at the base of the neck. Let's start testing it. How's that, fellas? Okay, we found it. Okay, so you don't let that fit cervical at all. How's the very top? Second cervical. Okay, that's another one. So a lot of swelling and edema right at the atlas. Yeah, atlas moved just fine. Occiput just fine. So here's the story with Meniere's, right? We got the inner ear. Okay? Now we have a nerve that's called the vestibulocochlear nerve. All right? There's actually two nerves. One of them deals with hearing, another one deals with balance. All right? Now it's not just one component that results in Meniere's. It's actually more like a perfect storm. There's a lot of things that need to go wrong just to cause Meniere's disease. So one component is, yes, the vestibulocochlear nerve is not functioning properly. Another component is we also have the trigeminal nerve over here. All right. This nerve also innervates part of the soft palate. We're talking the roof of your mouth. Okay. Now the reason why that's important is because we also have the eustachian tubes. It drains out from the ear and goes into the mouth itself. Now we can see it by going to our mouth. You'll see there's this tiny little hole here and a tiny little hole here. So those are the actual drainage from the eustachian tubes. Now, when the roof of the soft palate collapses, what it does is it pinches off the eustachian tube. So therefore, that can help explain why your right eustachian tube wasn't draining properly. That's why you had that fluid in your ears over here, okay? So we got that problem as well, right? So, and also we got other issues as well. Now, in terms of where I commonly find with Meniere's, usually this upper cervical region over here. But it's also, we also find that it fits cervical. Most patients with acute Meniere's usually just upper cervical. But since the fact that yours has been there for a very long time and it's chronic, okay, that's why your fit cervical also showed up as well. Now, we have another whammy, is we have this problem over here. So this helps explain why you had that essential tremors going on, is because usually I see biomechanically is that, and we also saw in your viewers as well, you start raising the shoulders and your hands are trembling already from there. So when we start raising our shoulders, dealing with the clavicle, the AC joint, SC joint, and the scapula, it challenges this area quite a bit. And we'll touch base on that in the x-ray in a moment, but I found a considerable issue at this level over here. Another one you have is also the sixth dorsal over here. And you also mentioned in consultation that, okay, you have heartburn. Well, that same nerve over here also deals with the stomach. So if this nerve is not working properly, it may cause the GERD and the heartburn, all right? Now, and the other component is, we'll illustrate down here, is that grade 2 sponding. That may help explain why other things going on, such as constipation, may affect the sexual organs, so on and so forth. So this is what we mean by a spondylolisthesis, a grade 2. These two bones over here, they need to line up, okay? Like this. But your bone went way forward. Take it like this. The border of the sacrum is over here, but your fifth lumbar went way forward. It's way past the halfway mark. So that's why we call this a grade 2 spondylolisthesis, which your medical doctor already did an x-ray and explained to you years ago, all right? So now we got that problem. And in addition to, that's what I already found out is these key spots, okay? Your sixth dorsal, the second dorsal, fifth cervical, and second cervical, so they're in trouble. Now, the reason why it became all that trouble is because when the foundation went out due to that spondylolisthesis, it's sort of like we're supposed to have like this, and we're supposed to move. Unfortunately, it's like someone just like snapped it and says, "Oh, what's going on over here?" Now it's like kind of loose. Right now, the only thing holding your bottom part and your top part is only your muscles and ligaments. There's no more bone connecting these two because of that grade 2 spondylolisthesis. Now, as a result of that, it changed the biomechanics over here. So what I'm saying is your whole entire spine is steadily rotating like this. Now, we cannot just simply like stay like this all the time. It's just not physically possible. So our head has to go like over here. Well, how's your body going to compensate? That's what happened started here. So start arcing and twisting over here. Your body's trying to rotate this way, but even though your body's like rotated here, you twist it over here, how does that solve anything? Your head's over here. It's gotta be over here. So it's twisting again over here, right? And then start retwisting over here, twisting over there. So we got that nice little twist going on. So we got twist over here, twist over here, twist here, twist here, twist there. It's just, right, you're all ringed up. So first things first, what we do is this, we're going to address this one first. Try to stabilize this as much as possible, right? Now there's no way I could permanently fix this because again, there's no bones holding it together anymore. It's gone, all right? The only other option is have a fusion surgery. What they'll do is they'll put a bolt here, a bolt here. The problem is, I don't know any surgeons who's willing to try to move the bones together again. They just simply bolt it in place. But if you bolt it in place, all your other problems, they're gonna stay that way as well. What we're gonna plan to do is we're gonna try to realign these two as close as possible, right? And it may biomechanically help reduce that tension over here and may improve your central nerve. We're gonna find that out in a moment over here. And then we're gonna double check what's going on over here, here, and there. There's a piece. There. Here's the other piece. Try to raise your hands a bit.
Oh.
Oh, what?
It's not that. Oh, there's still a.
Okay, start to come back a bit.
Yeah.
But overall, how much of a difference do you notice in the essential tremors?
It's lesser.
How much less?
Maybe 10% less.
10% less. Yeah. Okay. All right. That's a good start. How's your right ear now? Any difference in the right ear?
Dizziness.
What's going on with the dizziness?
And when I look at this side, it's lesser. It's lesser. The ear.
Good. How much less would you say?
Maybe 10%.
10%. All right. That's to be expected because that's a spondy. All right. All right. Go ahead. Let's work on the rest. Right there.
Oh.
There you go. Right. Raise your hands a bit. How's the tremors?
Oh. It's lesser.
How much less?
20.
20%. Good. All right. That's a good start. Let's get the rest. All right, go ahead. Raise your hands now.
Wow. It's less.
So how much less would you say now?
It's like 40, 50.
40, 50%,
Yeah.
huh? All right, tell us, how's the dizziness in the right ear feeling right now?
I don't, it's lesser, the muffle.
Mm-hmm. How's the fluid in the ears right now?
I'm not dizzy right now. Yeah, I'm not dizzy right now.
Nice.
Earlier I was.
But no more dizziness now.
Yeah.
Do you feel any difference in the fluid in the ears right now?
It's lesser.
Okay, how much less would you say?
Before, like 40%.
Good. That's a great start. Now, here's the thing. I just tested and confirmed on you. Your second cervical seems to be stabilizing a bit. We're not going to touch that right now, okay? Part of the reason why is because there's two nerves involved. Simple way to put it, sympathetic, parasympathetics, one's a gas pedal, one's a brake pedal. I don't want to ride the brake and the gas at the same time, all right? So right now we did mostly sympathetics just to stabilize things and get your nerves working again, right? Now in a future visit, I'll keep in mind what's going on with your second cervical. We may need to address that in the future. But at this moment, okay, let your body heal from all this. There's too many traffic jams going on. We have to clear all that, right, all that out of the way. Now bear in mind, okay, with how everything started to work again, right? Now we start to have more nerve function into your soft palate and also the right ear. You may experience three types of scenarios. Either A, you may feel like a waterfall gushing down your mouth, okay? B, you may feel like a little trickle, okay? And you may have to, you feel like, you still feel like you need to spit something out, okay? Or 3, you may feel like it says, no, there's no liquid, but some odd reason, you feel like you need to cough something out. So it's a small little trickle coming down, okay? So it may have either of those 3 type of scenarios in the next 2 days, okay? So that's what I'm expecting. Don't be alarmed about it. It's just all that gunk, draining out. I also recommend get a nice hot bowl, steam bath, drape a towel over it, inhale the steam, okay? Because there's going to be a lot of coughed up, stuck phlegm and all the other stuff in your sinuses. That's also going to start draining out as well. All right? Okay, that's going to be your homework. I'll see you next visit.
Okay, thank you.
Oh, you're very welcome.